Second degree AV block type 2. With a second degree AV block type 2 or a Mobitz type 2, the thing that's going to distinguish this rhythm from a second degree AV block type 1 is the fact that our PR intervals are going to remain constant before there is a loss in conduction, aka a dropped QRS complex. Remember, with a second degree AV block type 1, our PR intervals progressively got longer and longer and longer before we dropped a QRS complex. Here, you see that our PR intervals are not changing. They are remaining constant. Then boom, we have a P wave here and no conduction, no QRS complex, and then it's back to business as usual. So with our second degree AV block type 1, our memory trick was going, drop. Now you have a winky Bach. And so you can remember that you wink with one eye. So a winky Bach is a type 1. With our second degree type 2, we say if some P's just don't get through, then you have a type 2. So looking at our strip, you can have actually several P waves. A P wave, dropped QRS, and another P wave, no QRS, and another P wave. And so that would be a 2-to-1 or a 3-to-1 second degree AV block type 2, depending on how many P waves in a row have dropped QRS complexes. In this example, we only have one dropped complex just for the sake of me being able to show you this rhythm strip. But the more P waves that you have in a row that do not conduct, or there is not a QRS complex that follows those P waves, the more likely that patient is into going into third degree or complete heart block. So pathophysiologically, what's going on with a second degree AV block type 2? Well, again, it's an electrical conduction issue. And the electrical conduction issue with a second degree type 2 is somewhere down below the level of the AV node. Whereas within a second degree AV block type 1, there is an issue with the AV node itself. But when the issue lies below the AV node, say for example, the bundle of His or even down to the level of the Purkinje fibers, anything that we do to say stimulate the AV node, that's not going to help convert this patient out of this rhythm. A second degree type 2 block is much more scary than a second degree type 1 for many reasons. So if you think back to some of the causes of a second degree AV block type 1, some of it are reversible causes like drugs. Some reversible ischemia could be causing a second degree type 1, whereas with a second degree type 2, there's actual structural damage to the conduction system of that bundle of His Purkinje system, like an infarction, fibrosis of tissue, necrosis of tissue. So unlike a second degree block type 1, where it's due to kind of a progressive fatigue of the AV nodal cells, a second degree type 2 is a very sudden and unexpected failure of the bundle of His Purkinje system to conduct an impulse. The scariest part of a second degree AV block type 2 is the high probability that it will progress to a complete heart block. Therefore, the treatment of choice for this rhythm is definitely going to be transcutaneous pacing. I hope this has helped. Third degree AV block is going to be next. Go Vols.